Now then, Mr. Treadwell, what can I do for you?
It's his foot, Doctor.
Oh, yes? Your foot, is it, Mr. Treadwell? Well, what seems to be the problem with it?
It goes very cold and white, and whenever he lifts it up. I noticed it in bed last night. It was like the foot of the dead, it was. It was like a foot from beyond the grave. I said, you'll have to put a sock on that, Lenny. It's putting me right off.
Oh, dear.
I said to him, how long's it been like that, Lenny? And he said about a week.
Is it uncomfortable, Mr. Treadwell?
Well, it aches, Doctor. So I said to him, why didn't you speak up about it before? How can anybody help you, I said, if you don't speak up? But that's the kind of a man he is, Doctor.
I think I'd better look at this foot of yours, Mr. Treadwell.
Where shall I show you on my foot where it aches, Doctor? It's mostly across this bit here.
I'm afraid I really need to examine your husband's foot.
But I can show you on mine.
Yes, but your husband is a patient, Mrs. Treadwell.
Well, he doesn't like to take his shoes and socks off, Doctor. Except when he's with me. He's very self-conscious about his body, except when he's with me. He's got a very peculiar-looking parts, he has. I don't expect most women could tolerate them.
Well, all the same, I need to see his foot for myself.
It's there, Doctor. It's that bit there. That's where he says it aches.
Thank you, Mr. Treadwell. Now...
Look how cold and white it goes when he lifts it up.
Yes, thank you, Mrs. Treadwell.
It's one of them clots, isn't it? I said that to him straight away. A thrombosis. That's right, isn't it, Doctor?
No, I don't think it's very likely to be a deep vein thrombosis.
Oh!
I think what we ought to do...
My aunt had a foot just like that, and hers was a deep vein thrombosis. And my next-door neighbour, he had a foot just like that, and his was a deep vein thrombosis. My hairdresser's mother had a foot just like that, and hers was a deep vein thrombosis.
I really don't think it's very likely to be a deep vein thrombosis, Mrs. Treadwell.
Well, I must say, you might do some tests to see if it's a deep vein thrombosis or not.
What do you think, Mr. Treadwell?
Well, he's shocked, Dr. Airy. He's shocked. He's very shocked you're not even going to bother with any tests.
Well, I'm afraid I really can't help that, Mrs. Treadwell. It's my clinical opinion that Mr. Treadwell doesn't have a DVT, and I'm afraid I'm not the sort of GP who goes and organises procedures or tests for his patient when it's not clinically appropriate to do so.
Telephone for you, Dr. Airy.
Oh, bloody hell. Right in the middle of a Jaffa cake. Hello? Who's this?
This is the registrar from A&E at the hospital. What do you think you're playing at sending this patient down here?
What patient?
This chap Treadwell. You've sent him down here with a suspected DVT. It's obviously not a DVT.
I did do my best.
And his wife said you told them they wouldn't have to wait. She said he'd got a very urgent DVT, and you told them that they'd be seen and investigated immediately.
I never said immediately.
Well, she said you did. And what did you send them here for in the first place? It's obviously not a DVT. Even an idiot could see that.
I did try to explain.
It's a complete waste of our time. I thought you GPs were meant to have a gatekeeper role. Crikey!
As I said, I did try.
There's no gatekeeping going on at all. You're just shunting them straight down to the hospital, and you're not even sending them to the right department. Crikey, it's incompetence. Have you been a GP very long?
20 years, as a matter of fact.
Well, you'd never know it.
Now, look here, you little pipsqueak.
Who are you calling a pipsqueak? Just because I've got a youthful timbre to my voice, I could be 6'5" for all you know.
I've got a good mind to come down there and punch you in the head.
Just try it, fatso. I go to judo classes after work, I do. I could flip you like a pancake.
I'd squash you like a bug.
I'd rotate you like a propeller. I'd fly you like a kite. I'd play you like a saxophone. I shall pack this chap back to you for referral to a more appropriate specialist. I bid you good day.
Hello? Ah, cheeky little bastard. I bet he's only been in the job 5 minutes. Jumped up little turd. I'm going to write a letter of complaint. Did you get his name, Tina?
No.
Bollocks. Why on earth not?
Well, did you get it?
He was probably deliberately withholding his name to avoid having a complaint made against him. The evil little prick. Just write a letter, Tina, to whoever is in charge at A&E, complaining about whichever registrar is on duty today.
I'm not writing it.
OK, then. I'll write it myself. Let's see. Dear A&E. Dear Sir or Madam. I want to complain. I'm writing to complain. I was outraged and offended. Bugger it, I can't be bothered.
Righto!
The worst thing is he's sending them back here. I can't bear to talk to that bloody stupid woman again. Look, all the appointments are full this afternoon. Whatever you do, if they get in touch, don't book them into an urgent slot. Tell them there aren't any.
Hello, surgery, can I help you? Oh, hello, Mrs. Treadwell. Yes, we did get a call from A&E. No, I'm sorry, there aren't any this afternoon. Oh, did he? Well, just hold on a minute. She says the registrar told her it was absolutely essential for Mr. Treadwell to be seen again by you this afternoon.
Ah, crappy crap. Tell her I'm referring Mr. Treadwell to a vascular surgeon. Tell her I'm doing it right now.
Well, can't you tell her?
No, tell her I'm too busy to come to the phone because I'm writing a referral right this minute. Tell her I'm marking it urgent and we'll fax it straight away, and there's no point coming in because I'm doing a referral and I'm marking it urgent and we're going to fax it straight away.
Hello, Mrs. Treadwell. He says he's doing a referral to the vascular surgeon and he's going to mark it urgent and fax it straight away. Oh, right. Hang on a minute. She says, can you mark it? Immediate attention. I must be seen and dealt with immediately.
Yes, all right. Tell her I'm writing that in.
Yeah? She says, can you put super urgent, matter of life and death?
Yes, all right. Anything?
Yeah? She says, will Mr. Treadwell be seen by the consultant tomorrow?
Tell her I really can't guarantee that.
Well, I'm afraid he says he really can't guarantee that, Mrs. Treadwell. She says, can she speak to you personally, Dr. Airy?
Oh, shitty bumholes. Right, still a few minutes before my first patient. Might as well have a look at the old bank balance, see if I've gone bust yet.
That consultant told my Lenny he might have to have his foot cut off.
Jesus! How did you get in here?
Did you hear what I said, Doctor? That consultant told
Where's
my
Tina?
husband...
Isn't she in reception?
Well, she said we could come straight in.
She said what? She'd never do that. You've killed her, haven't you?
No, Dr. Heary, that wasn't necessary on this occasion. I just offered her a nice chocky.
Well, she does like chockies.
The point is, Dr. Heary, Mr. Goldfinger told my husband he might have to have his foot cut off. Have you had a letter from him yet?
I only referred you to him yesterday.
We saw him at 6 p.m, and he did say he was going to write straight away. I'm surprised if you haven't had a letter yet. What do you mean, one of these? One is lying on your desk?
Please leave those letters alone, Mrs. Treadwell. Those are confidential letters about other people.
Well, are you sure you haven't got one about Lenny?
No, I haven't got a letter about your husband.
Well, I can tell you what he said. He advised immediate surgery, that's what he said. He said immediate surgery, and then in the next breath, he said he was off to Holland for the weekend. As calm as you like. Well, my husband's very anxious. He needs immediate treatment, that's what he needs.
Well, it's very difficult for me to comment on any of this when I haven't even seen anything in writing yet.
But I'm telling you what Mr. Goldfinger said. Can't you just ring him up and ask him why he can't do the operation before he goes to Holland?
Well, if he's going away for the weekend... It's Friday now.
Well, I don't think it's asking very much just to ring him up, Dr. Airy. Just to ring him up and ask him. I don't think that's asking very much when one of your patients is terribly upset and distraught and anxious, and he's got a very urgent condition that needs very urgent treatment.
Now, look here, Mrs. Treadwell, you only saw the consultant last night. I really don't think it's appropriate for me to be ringing you up like this, but I wonder if I could just have a quick word.
Who's this?
It's Dr. Hairy.
Hairy?
Yes, I just wondered if I could have a quick word with you about Mr. Treadwell.
Treadwell?
Yes, Mr. Treadwell, I referred him to you.
Referred?
Yes, I sent you a fax about him, an urgent fax.
Ah, a fax. Marked, super urgent. Matter of life and death, was it?
Yes, that's the one.
Bloody rubbish.
Well, yes, I'm sorry about that, Mr. Goldfinger.
Chap with ice-cold foot?
Yes, that's him.
Rather a horrible, interfering wife. The type that would ride roughshod over any weak-minded clinician.
Well...
rather interesting case, though. Ice-cold foot interesting, that is. Not wife. Wife interesting case for psychiatrist.
The thing is...
Look here, Harry. Is this going to take long? One's rather pushed for time, as a matter of fact. Play to catch, don't you know? A bulb fancying festival in Holland.
Bulb fancying?
Bulb fancying, yes, bulb fancying. Spot a bulb fancying in Holland. Hobby of mine. Tulips, don't you know? Grow them. Rare varieties. Potting up. Plenty of drainage. Sharp sand's the thing. Play to catch. No time to chat. Must be going. Bye.
Well, just before you go, Mr. Goldfinger.
Damn it all, man. Now what?
Did you tell Mr. Treadwell he might have to have his foot cut off?
What?
Well, the thing is, Mr. Treadwell has got it into his head. His wife has got hold of the idea.
Bloody woman. Needs to be throttled.
Well, she says you told Mr. Treadwell that he might have to have his foot cut off.
Stuff and nonsense. Tosh. Haven't cut off a chap's foot for years. Like to, mind you. Cutting off a chap's foot? First rate.
And you didn't say immediate surgery was essential? Immediate surgery? Poppycock. No such thing. Good Lord, man. Have you been a doctor for long? Yes. 20 years, as a matter of fact. Immediate, urgent, emergency, silly words. Never use them oneself. Public don't understand them. Urgent, 3-month wait. Immediate, 2-month wait. Emergency, 15-hour wait. On a trolley, in a drafty hospital corridor. So there's no way you could operate on Mr. Treadwell in the next few days? No, absolutely not. Well, I warn you, Mrs. Treadwell won't be very happy. I think she's quite likely to try to get in touch with you herself. Can't be done. One's catching a plane to Holland. One simply can't be contacted. Incommunicado. Sorry, Mrs. Treadwell. Very sorry. Afraid you'll have to wait.
Wait? What do I have to wait for?
Mrs. Treadwell, wait outside.
I'm here to see the operation, Mr. Goldfinger.
Operation? Is one doing one?
Yes, well, my husband, Lenny.
Rather thought one was in Holland. Tulip Festival, purchasing bulbs. Pockets full of bulbs.
Oh, yes, that was where we met you.
Ah.
We met you there, and you very kindly agreed to come back and do the operation on my husband.
One vaguely recalls, accepting a chockey, then, everything rather blank.
Yeah, that's it. You had one of my chockies, and then we came back here.
Is the patient anaesthetised, nurse?
Fully anaesthetised, doctor.
Outside, please, Mrs. Treadwell.
Oh, no, I want to stay here to make sure nothing goes wrong.
No. Out of the question. No civilians.
Well, I shan't be in the way.
Nurse, please escort this lady outside.
Come along with me, please. Would you like a chockey? I do like chockies. Here you are then, dearie. Ooh.
There. That's the first incision. Forceps, please, nurse.
Everything all right? Sorry.
Damn a blast!
Did I make you jump?
This really is the absolute limit. Never in one's life. Absolutely beyond everything. All civilians outside this second.
Oh, but I only wanted to see.
Out!
Ooh, I came over all faint. Ooh, what was that?
Search the floor, nurse.
Sorry?
Search the floor, nurse.
You'll have to speak up.
One has accidentally cut off his,
Sorry?
one of his ghoulies.
Ghoulies?
Keep your voice down. Think it rolled onto the floor.
Onto the floor? Would this be it?
Good God. What's happened to it?
I think somebody might have trodden on it. Will it still be all right?
All over. End of one's career. Incident like this. Scandal. Inquiry. Curtains for surgeon. Private practice in ruins. No more golf with managing directors. Probably end up working night shifts in NHS hospital.
I'm sure it won't come to that.
Dear God, one has never asked for much. Wouldn't ask now, but no alternative. One doesn't really believe in you, if truth be told. But please help. Small miracle. Not much effort for you. Make tremendous difference to one. Close one's eyes. Count to 3. Put one's hand in one's pocket. Please let there be something in there. 1, 2, 3.
Ooh.
Well, Mr. Treadwell, how are things? Is your foot better?
Oh, yes, his foot's completely back to normal, Doctor.
Oh, well, that's good to hear. So what can I do for you today?
It's an unrelated matter, Dr. Heary.
But it's to do with Mr. Treadwell, is it? It's his name that's in the appointment slot.
Oh, yes, there's no problem with me. Well, there's never been a problem with me. It's Lenny that's the problem.
All right then, Mr. Treadwell. Well, would you like to tell me about it?
Well, he won't tell you, Doctor, because he's too shy. He's very introverted, shy and self-conscious, that's him. He just won't speak up for himself.
You can speak freely to me, Mr. Treadwell. I've heard it all before.
It's his libido, Doctor. He's too shy to come out with it. Why don't you tell the doctor about your libido, Lenny?
What? There's a problem with it, is there?
Well, he's lost interest, Doctor. Completely lost interest, he has.
I can't be bothered.
Don't be so disgusting, Lenny. I can't get anything out of him, Doctor. Our nightly routine has completely gone to pieces. I mean, we've still got the Scrabble and the cocoa, but what's it all leading up to?
I'm just not bothered.
Will you be quiet, Lenny? He's very upset, Doctor. He feels as if there's something missing from our marriage. He's inconsolable.
I can't be asked.
Shut up, Lenny. I've tried everything, Doctor.
I see. So, do you find that nothing arouses your interest, Mr. Treadwell?
No, nothing at all. He just will not be aroused.
Well, there is one thing.
Lenny!
Oh, really?
Well,
I was watching Gardener's World the other evening, while the wife was making the cocoa.
Lenny! You never told me about this.
That Rachel de Tame was potting up bulbs.
Lenny!
And it gave me a stiffy like a little truncheon.
Right, come on.
Where are you going, dear?
Well, the garden centre. It closes in 10 minutes.